You could go blind and not even realize it. That's right, diabetes can silently steal your vision. No pain, no warning. And by the time you notice something's wrong, it might already be too late. Blurry vision, trouble reading, tired eyes. It may seem normal, but it could be the start of something serious. Many people go through this and only find out when the problem is already advanced. But here's the good news. You can prevent all of this. With a few simple actions, you can protect your eyes and stop diabetes from damaging your vision. So stay with me, because in this video, I'm going to show you 10 essential steps to save your eyesight before it's too late. But before we dive in, comment below and tell me what city you're watching from. I'd love to know where you're from. And make sure you're subscribed to the channel, because I'll be bringing you a series of videos that will help you control your diabetes and reclaim your health. Let's get started. 1. Strict blood sugar control. If there's one thing every person with diabetes needs to understand, it's this. High blood sugar is like a silent bomb inside your body. It slowly damages everything it touches, and your eyes are among the most affected. The problem is, in the beginning, you feel nothing. Your vision seems fine, so you think everything is okay. But on the inside, the tiny blood vessels in your retina, an extremely delicate part of the eye responsible for capturing light and forming images, are being attacked. Over time, these vessels can rupture, leak blood or fluid, or grow abnormally. This can lead to blurry vision, dark spots, or even blindness. This condition has a name, diabetic retinopathy, and it's more common than you think. But here's the good news. It can be prevented. How? By keeping your blood sugar within the recommended levels consistently. That means checking your glucose regularly, doing lab tests, following a nutritionist-guided diet, avoiding sweets and refined carbs, taking medications on time, and exercising regularly. Taking care of your blood sugar is like taking care of your eyes with your own hands. You might not see what's happening inside, but every choice you make affects your vision directly. And remember, it's easier to prevent than to treat. The sooner you control your glucose, the greater your chances of keeping your vision clear for many, many years. Did you know that one of the most effective ways to control your blood sugar and improve your health is through nutrition? And I know how hard it can be to find healthy and practical diabetic-friendly recipes. That's why I created Smart Eating, the nutritional guide for diabetics, with delicious recipes for every meal of the day, designed to help you control your glucose and boost your health. Don't miss this opportunity to transform your eating habits. Download the guide now by clicking the link in the first comment below the video. But hurry, the link will only be available for a limited time. 2. Monitor your blood pressure. Did you know that high blood pressure can be just as dangerous to your eyes as diabetes itself? That's right. Many people focus only on blood sugar and forget to monitor their blood pressure, and that can be a serious mistake. Uncontrolled hypertension greatly increases the risk of hypertensive retinopathy, glaucoma, and even retinal detachment. Complicated names, but the result is simple and scary: vision loss. High blood pressure puts too much force on the tiny, delicate vessels in the eyes. Over time, this excessive pressure can make these vessels thicker, stiffer, or even cause them to burst, leading to bleeding and inflammation inside the eye. In more advanced cases, it can cause sudden vision loss, like someone flipping off a light switch. And the worst part? People usually feel nothing. That's why it's called the silent killer. You only find out when the damage is already done. That's why anyone with diabetes should monitor their blood pressure closely, even if they've never had problems before. Here's a simple but powerful tip. Check your blood pressure regularly, at least once a week, even at home. If it's often above 130/80, talk to your doctor. And if you're already on medication for hypertension, don't skip a single day, even when you feel fine. Also, cut back on salt, avoid ultra-processed foods, sleep well, and do light physical activity like walking. Remember, taking care of your blood pressure is taking care of your eyes. With controlled pressure, your vision is safer, your mind feels lighter, and your health is on the right track. 3. Get annual eye exams. Listen, you might be seeing everything perfectly today, but your eyes could still be affected by diabetes, and you wouldn't even notice. That's because the most serious eye problems like diabetic retinopathy, glaucoma, and macular edema often start silently, without any symptoms. By the time your vision starts to fail, the damage may already be advanced, and sometimes irreversible. That's why getting an eye exam every year, even if you feel fine, is one of the most important things a person with diabetes can do. The most recommended exam is the dilated eye exam, also known as retinal mapping. With it, the ophthalmologist can see inside your eye. It's like looking backstage at your vision. This way, they can detect even tiny changes in the blood vessels before they turn into serious problems. And here's a heads up. If you already have some eye changes or have had diabetes for many years, this exam might need to be done twice a year. And don't think, oh, I don't feel anything, so I must be fine. The whole point is to catch issues before symptoms appear, because that's when it's still treatable and your vision can be preserved. So, make this a priority. Schedule and complete your eye exam every year with a doctor who understands diabetes. It's a simple, quick, and highly effective way to protect something priceless, your vision. 4. Don't smoke. If you have diabetes and still smoke, you need to know something urgent. Smoking is like throwing gasoline on a fire. It worsens all the damage diabetes can already do to your body, and your eyes are among the first to suffer. That's because smoking directly affects blood circulation, making it harder for oxygen and nutrients to reach the eye tissues, especially the retina, which is extremely sensitive. Smoking narrows blood vessels, raises blood pressure, and makes the blood thicker and harder to flow. And when the retina doesn't get enough oxygen, it begins to die little by little. This drastically increases the risk of diabetic retinopathy, macular degeneration, glaucoma, and even blindness. And don't think this only happens to heavy smokers. Even people who smoke just a little or once in a while are putting their eyes at risk. Cigarettes release over 7,000 toxic substances, and many of them are inflammatory, meaning they cause even more damage to the already vulnerable vessels affected by diabetes. The good news? Once you quit smoking, your body begins to recover almost immediately. Circulation improves, blood pressure tends to stabilize, and the risk of eye complications drops significantly. So if you smoke, consider giving it up. Not just for your lungs or your heart, but for your eyes, your vision, and your freedom to see the world clearly. 5. Exercise regularly. If you have diabetes and want to protect your vision, here's a powerful secret. Movement is one of the best medicines out there. And we're not talking about running marathons or lifting heavy weights. Simple activities like walking, cycling, dancing, or even stretching can help a lot. Regular physical activity helps lower blood sugar levels, improves circulation, controls blood pressure, and supports healthy cholesterol levels. All of these together protect your eyes, especially the delicate blood vessels in the retina, which are the first to suffer from high glucose or high blood pressure. Plus, regular exercise reduces inflammation, boosts insulin sensitivity, and helps manage weight, all of which lower the risk of eye complications. It's like doing an internal cleanse that keeps everything running smoothly, including your eyes. And there's more. Exercise also boosts your mood, improves sleep, and gives you more energy to take care of your health overall. But remember, if you have any physical limitations, talk to your doctor before starting to find an activity that's safe and right for you. Start slow, but start. Bottom line, people who move see better for longer. So get off the couch and take care of your vision with every step you take. 6. Watch your diet. You've probably heard the saying, "You're what you eat," right? Well, when it comes to protecting the eyes of someone with diabetes, that phrase has never been more true. Diet is one of the key pillars for keeping blood sugar under control and preventing the silent damage that high glucose levels can cause to your eyes. When you eat foods that are high in fiber, low on the glycemic index, and rich in antioxidants, you help your body keep sugar levels more stable. That prevents blood sugar spikes that, over time, damage the tiny blood vessels in the retina and raise the risk of diabetic retinopathy, glaucoma, and macular degeneration. Include foods in your daily routine like dark leafy greens, spinach, kale, broccoli, omega-3, rich fish like sardines and salmon, seeds, Low-sugar fruits like strawberries, avocado, and apples with skin, legumes, and whole grains. These don't just protect your eyes. They help your heart, kidneys, and brain too. And what should you avoid? White sugar, sodas, artificial juices, white bread and pasta, fried foods, and ultra-processed items. These spike your blood sugar quickly and increase inflammation in the body, a dangerous combo for anyone with diabetes. So treat your diet with care. Think of each meal as a chance to nourish your body and protect your vision. Eating well isn't just a health choice. It's a choice for freedom, to see life more clearly, and for many more years to come. 7. Control your cholesterol. When we talk about protecting the eyes of people with diabetes, many think only about controlling blood sugar. But there's another silent villain that often goes unnoticed: high cholesterol. And believe it or not, it could do serious damage to your vision. Too much cholesterol in the blood leads to fatty plaque buildup in the walls of blood vessels. This harms circulation and makes it harder for blood to reach the eyes properly, especially the retina, which relies heavily on good oxygenation. Over time, these blockages can lead to diabetic macular edema, a swelling in the retina, and can also worsen diabetic retinopathy. High cholesterol is also linked to a greater risk of glaucoma and age-related macular degeneration, two other serious threats to vision for people with diabetes. That's why it's so important to keep your cholesterol under control. How? With a balanced diet rich in fiber, like oats, chia seeds, and fruits with skin, using healthy fats, such as olive oil and avocado, avoiding fried and processed foods. And of course, by exercising regularly and taking prescribed medications if needed. Ideally, you should have regular blood tests to monitor total cholesterol, LDL, bad, and HDL, good. Remember, controlled cholesterol means clean vessels, better circulation, and better protected eyes. 8. Treat any visual changes immediately. You know the saying, timing is everything. When it comes to eye health and diabetes, that couldn't be more true. If you start to notice blurry vision, floating black spots, trouble seeing at night, shadows, wavy lines, or any kind of visual change, don't wait for it to go away on its own. It could be a sign that something serious is already happening in your retina. And the sooner you act, the better your chances of avoiding vision loss. Many people ignore it, thinking it's just tiredness, age, or something that will pass. But when it comes to your eyes, delaying treatment is a huge risk. Some diabetes-related eye complications, like diabetic macular edema or proliferative retinopathy, progress quickly and can cause permanent damage if not treated in time. The good news is that many of these conditions can be treated when detected early, with specific eye drops, laser therapy, medication, or even minor surgery. But all of this only works if the diagnosis is made in time. So if you notice any change in your vision, no matter how small, see an eye doctor right away. It's not an overreaction. Sometimes even one day of delay can mean the difference between keeping or losing part of your sight. Your body gives you signs, and so do your eyes. Don't ignore them. 9. Avoid self-medicating your eyes. It might seem harmless to use random eye drops when your eyes are red or irritated, but if you have diabetes, that can be a dangerous mistake. Self-medicating your eyes is like playing in the dark with something serious. You don't really know what you're treating, and you could end up making things worse. Many diabetes-related eye diseases, like retinopathy, glaucoma, and macular edema, don't cause pain in the early stages. And when symptoms like blurry vision or spots appear, it usually means the issue is already developing. At that point, using drops without medical advice can mask the symptoms, delay a proper diagnosis, and even worsen the damage. Also, steroid-based eye drops, which are common in pharmacies, can raise eye pressure, increasing the risk of glaucoma, especially in people already predisposed to it, like those with diabetes. The rule is clear: never use eye drops or medications without professional guidance. If you feel any discomfort or change in your vision, see an ophthalmologist immediately. They will find the root cause and recommend the right treatment for you. When it comes to your eyes, you can never be too careful, especially if you live with diabetes. To sum it up, eyes are serious business. Only treat them with professional guidance. 10. follow the prescribed treatments properly. This tip might sound simple, but it's absolutely essential. If your doctor prescribed a treatment, whether for diabetes, your eyes, or any other condition, follow it exactly as instructed. Don't skip doses, don't change the schedule on your own, and don't stop treatment just because you're feeling better. With diabetes, care has to be ongoing. Blood sugar control, for example, is a daily process. If your doctor prescribed insulin, medications, a special diet, eye drops, or anything else, it's because your body needs that support to stay balanced, including your eyes. The truth is that most vision problems caused by diabetes can be avoided or controlled if the treatment is followed correctly. But just a few days of neglect, like forgetting medication, overeating, or not checking your glucose, can cause your blood sugar to spike and start damaging your eye vessels, even without symptoms. So treat your care routine as a commitment to yourself. Organize your schedule, use reminders, get support from family, do regular checkups, and stay disciplined. Remember, your vision depends on your daily choices, and every right choice brings you one step closer to a healthier, more independent life, with clearer vision, literally. Those who take care of their health see a brighter future. Those who take care of their health see a brighter future. See how small actions can make a big difference? Taking care of your vision is a key part of managing diabetes. And the sooner you act, the better your chances of keeping your eyes healthy for life. Now tell me in the comments, which of these tips do you already practice in your daily routine? And if this video helped you in any way, leave a like, subscribe to the channel, and turn on notifications so you don't miss any new content. Your eye health will thank you, and so will your vision. See you in the next video.